Welcome to the deep dive. Today we're diving headfirst into a really significant milestone for families, one that involves tiny humans, tiny toilets, and, well, a whole lot of patience. Potty training.
It really is a big one, and it's a topic that sparks just endless conversations among parents, right? Wading through all the advice out there can feel pretty overwhelming.
Absolutely. So for this deep dive, we've gathered like a big stack of sources we've pulled from parenting sites, looked at what medical experts say, and dug into those really valuable insights shared by parents themselves, in online communities.
Yeah, the goal was to get a kind of comprehensive picture, mixing that clinical guidance with the real world stuff from families who are actually like navigating this process day in and day out.
Think of this as your essential guide, sort of cutting through the noise to find the key approaches, the potential bumps you might hit along the way, and honestly, some genuinely surprising insights about getting your little one confidently out of diapers.
Our mission really is to pull out the most important nuggets of knowledge so you feel informed and hopefully ready for whatever the stage brings.
Okay, let's unpack this.
Let's do it.
So jumping into these sources right away, one major theme that just leapt out was, while age gives us a general idea, readiness is the real key here. It seems like trying to push it too early is just, well, a recipe for frustration.
That's absolutely right. The research, the expert advice, it all consistently shows that forcing it before a child is, developmentally ready, both physically and emotionally. It often just backfires. It's counterproductive.
Right. The sources mention the average age parents start in the U.S. is usually somewhere between 2 and 3 years old. And most kids get the hang of daytime control by 3 or 4. But a really crucial point I saw highlighted again and again is that nighttime dryness.
Yeah.
That often comes much later, sometimes not consistently until they're 5, 7, or even older.
And that delay is perfectly normal. It's so important to stress that. The sources explain that nighttime control is much more tied to specific developmental things. It's not just about muscle control. It involves hormones like ADH,
Yeah, that one.
which helps the body concentrate urine overnight. And their brain and bladder also need to develop that connection, to actually wake them up when they need to go while they're asleep. You can't just teach that. It's biological. It unfolds over time.
Okay, so if age is just a guideline, what specific signs should parents be looking for? Things that signal their child might actually be ready to start thinking about this.
Yeah, the sources give us a pretty good checklist. Physically, can they walk confidently to the potty chair or the toilet on their own? Can they manage pulling their pants up and down? That's a big one.
Oh, yeah.
Are they staying dry for, say, at least 2 hours at a time during the day? Or are their diapers maybe dry after naps or even overnight sometimes? Do they have fairly predictable bowel movements, like not going constantly all day?
Makes sense. And beyond the physical stuff, what about awareness?
Right. Look for signs of awareness and communication. Do they signal somehow when they need to go? Maybe they start wiggling or squatting or tugging at their clothes. A really key sign is if they start telling you they need to go before they actually go, or even asking for a diaper change right after they've gone. That shows awareness.
Okay, so they're noticing the feeling.
Exactly. Do they show discomfort when their diaper is wet or dirty? Are they starting to use simple words like pee or poop and actually seem to understand what the toilet is for?
It really sounds like it's about them tuning into their own body's signals.
Totally. And behaviorally, are they showing interest? Like, do they follow you into the bathroom? Do they seem curious about what you're doing in there?
Right.
Do they want to copy you? Or maybe older siblings? Do they seem okay with sitting on the potty chair? Even just for a second, maybe closed at first. Can they follow simple directions generally? And do they seem to have that desire to please you?
So you don't need all of them at once.
No, not at all. The sources suggest that seeing even just 1 or 2 of these signs consistently might mean it's a good time to, start exploring the idea gently.
Okay, so spotting readiness in your child is, like, foundational. But here's a nugget from the sources that really struck me. Your readiness as the parent is just as crucial, maybe even more so sometimes.
Oh, that's such an important point, and it came up again and again in the parent experiences shared online. Potty training takes significant time and energy, and consistency. You need to be prepared for consistency over several months, really.
Yeah.
So if you're heading into this phase feeling completely burnt out or overwhelmed or stressed about other things, it's just going to be much harder to maintain that calm, supportive environment they need.
And the sources were really clear that you shouldn't view difficulties, accidents or whatever, as some reflection of your child's intelligence or them being deliberately stubborn. patience is absolutely essential.
For sure. And practical timing matters too. The experts and parents alike strongly advised against starting during or even right before a major life change for the child.
Like what kind of things?
Things like welcoming a new baby sibling, moving house, starting a new school or daycare, big transitions. It's usually better to wait until things settle down a bit so you can dedicate the focus needed for potty training.
Okay, that makes sense. So once you've assessed readiness, you feel like the timing is right, the sources seem to outline a pretty clear path for like setting the stage and starting those daytime strategies.
Right. And it's definitely a gradual process. Many sources suggest starting months before you even think about active formal training. Like around 18 months is a good time to simply introduce and use words like pee, poop, and potty frequently, just casually in everyday conversation.
So normalizing it.
Exactly. Normalize it. Explain that everybody does it. It's just like waste your body makes. And the sources really stress avoiding negative words like dirty or yucky around it. Keep it neutral.
Just integrate it naturally into their world.
Yes. And point out the physical signs you observe in them. Calmly state what you think is happening. It looks like maybe poop is ready to come out. Encourage them to come with you for diaper changes. And try to make the changes themselves a neutral or even pleasant interaction. Definitely never show frustration or punish them for a soiled diaper. That can create so much anxiety around the whole process later.
And as they get a little older, maybe closer to 2.
Yeah, by around 21 months, according to the sources, you can start explaining what the toilet is actually for and maybe point them out when you see them in different places like public restrooms.
Then comes the moment of truth.
Yeah.
Introducing the actual potty chair.
Exactly. And the consensus in the sources seems to be starting with a small, standalone potty chair placed right on the floor.
Why is that better than just a seat on the big toilet?
Well, it feels much more secure for little ones, you know? It's not high up. And crucially, their feet can rest flat on the floor, which actually helps them push if they need to poop. If you do use one of those seat inserts on the adult toilet, definitely make sure they have a sturdy step stool for their feet.
Gotcha. I saw in the sources that letting the child just explore the potty chair without any pressure was really emphasized. Why is that so important?
That came up a lot in the parent stories, just letting them get used to it, first maybe playing with it, sitting on it fully clothed, then maybe without pants just for a minute. It helps demystify it, takes the scariness away.
Right.
And the sources are very firm on this, never strap them onto it. They absolutely need to feel they're in control and can get off whenever they want. Forcing them to stay put is a quick way to build resistance or even fear.
Okay, so they're comfortable with the chair. What's the next practical step the sources suggest?
Practice runs. Those seem key. Basically, lead your child to the potty. When you see those readiness cues, the wiggling, the squatting, maybe a certain face they make, have them sit there, maybe with their diaper off, and keep these initial sittings really short, like maybe just 5 minutes max. The absolute priority here, the sources say, is praising them just for trying, even if absolutely nothing happens.
Just for sitting there.
Just for sitting there. And a crucial tip, both for safety and avoiding fear, never flush the toilet while they are still sitting on it. That noise and the disappearing water can be genuinely terrifying for a little kid.
Good reminder. Any specific tips mentioned for boys?
Yeah, for boys, many sources recommend starting with peeing while sitting down first. It's often easier for them to relax the right muscles and, control starting and stopping when they're sitting. You can introduce standing up to pee later, maybe after they've consistently mastered pooping on the potty.
Consistency seems like it would be absolutely vital here.
Oh, it's huge. Absolutely huge. The sources really advocate for making potty time a predictable part of the daily routine. Think like first thing in the morning, after meals and snacks, maybe after playtime, before bath time, and definitely right before bed. Some parents shared that setting a timer maybe every hour, hour and a half in those early days really helped them remember to offer the potty consistently.
Do you have to keep using the timer forever, though? That sounds intense.
No. The sources say that's really just a temporary crutch. It's to build that consistent habit for you as much as them. Once your child starts initiating going to the potty sometimes without you prompting them every single time, you can start to phase out those constant reminders.
So only prompt if you see a clear sign.
Yeah, exactly. If you see one of those obvious readiness signs that they seem to be ignoring, then gently prompt. Otherwise, let them start taking the lead.
And then comes the big transition. Actually getting rid of the diapers during the day.
Yes. Okay, so once they've been pretty consistently using the potty during the day for, say, maybe a couple of weeks with only minimal accidents, the sources generally suggest transitioning from regular diapers to training pants or pull-ons.
What's the benefit of those?
Well, they offer a bit more independence, feel different than a diaper. Often they feel wetter faster, which can help awareness. Then, once they've managed a full day, or maybe even a couple of days, of consistently using the potty, it's time for the big leap. Underwear.
Exciting.
Yeah. And a great tip from the parent experiences was letting the child actually pick out their own big kid underwear. That can be a huge motivator. At this stage, diapers or pull-ups are usually just reserved for sleep time and maybe long car trips.
And hygiene. Can't forget that.
Essential. Teach basic hand washing after every single trip to the potty, even if nothing actually happened. And for girls, it's really important to teach them early on to wipe from front to back to help prevent bacteria from spreading and causing infections.
Okay, switching gears slightly. One really powerful theme across almost all the sources we looked at was the effectiveness of positive reinforcement.
It really feels like the backbone of so many successful approaches, doesn't it?
It does. The sources just emphasize again and again that reinforcing the behavior you want to see makes the whole process much more positive for the child. And, as some research suggests, it might even potentially help them achieve consistency faster.
So praise their efforts constantly. Praise them for pulling down their pants by themselves. Praise them just for sitting on the potty. And especially, make a huge deal out of those first successful trips.
Like a potty party.
Basically. A genuine smile, a clap, a big hug. These things go a really long way.
And the sources talked a lot about tangible rewards, too, like stickers or maybe small treats.
Yes, those are very commonly suggested tools, and many parents found them highly effective, particularly in the initial stages to get things going. Stickers are huge. Creating a sticker chart where they can visually track their progress is great. Or small treats like, a single M&M, maybe a few Cheerios, or even a tiny bit of special juice they like. Other non-food rewards could be extra playtime, getting to choose the next book you read together, or some other special activity.
I saw one source mention something called an over-the-hump gift. What's that about?
Yeah, that's kind of a specific technique. It's sometimes suggested if a child is particularly anxious or really hesitant. The idea is giving a small gift very early on, maybe for just trying hard or achieving that very first success. It can serve as a powerful, positive anchor, sort of reminding them later when they feel nervous that they can do it.
But you wouldn't keep giving rewards for every single success forever.
No, that's crucial. The sources are clear. Rewards are a temporary tool. The idea is definitely to phase them out as consistency improves. So you might start by rewarding every single successful trip, then maybe transition to rewarding every 2 or 3 trips, then maybe every 5 or 6.
Using that chart, maybe.
Yeah, using that potty chart can really help make the progress visual and help them understand why the rewards are becoming less frequent. Eventually, the intrinsic pride of being a big kid takes over.
Okay. Beyond rewards, books came up really frequently as a helpful tool.
Absolutely. Potty training books were consistently mentioned by parents as being super valuable. They can keep kids engaged, explain concepts that might be confusing in a really child-friendly way, and just help normalize the whole process.
Were there specific types that seemed more effective?
Well, some work really well because they feature beloved characters the child already knows and loves, like Daniel Tiger's Potty Time or P is for Potty with Elmo. Kids connect with those.
Right.
Others are highlighted more for their straightforward approach to just normalizing body functions. Everyone Poops was specifically called out by many parents as being fantastic for tackling anxiety around pooping, which is really common.
And for parents who are looking for, a specific method to follow, a system.
Yeah, the sources did mention some popular parent guides. Things like, oh crap, Potty Training, which outlines a kind of block schedule approach, and the very well-known Potty Training in 3 days.
Does the 3 days thing actually work?
Well, some parents reported finding these methods provided a really quick start or laid a good foundation within maybe about a week. But the sources generally caution that 3 days is often more about getting the very basics down. Achieving true, consistent, reliable potty use usually takes much longer for most children. It's really important to manage your expectations based on your individual child.
Okay, that's realistic. But what happens when things don't just click smoothly?
Yeah.
The sources definitely acknowledge that potty training is rarely perfectly smooth sailing. Challenges are very common.
Oh, they absolutely are. And the first big one is accidents. They will happen. It's not a sign of failure, yours or theirs. It's just a normal part of learning any complex new skill.
Right.
And the number one rule emphasized by literally every expert and parent source we looked at is stay calm. Never, ever punish, yell, scold, or shame your child for having an accident.
That seems so critical for keeping things positive.
It is. Your reaction really sets the tone for the whole experience. Just calmly clean up the mess without making a big fuss about it. Offer gentle encouragement, something like, oops, he goes in the potty. Next time, let's try to get it there.
So, not getting angry.
Definitely not angry. You might, very occasionally and very gently, express mild disapproval of the act itself, like, big kids don't usually like having wet pants. But the primary focus absolutely needs to remain on encouragement for next time. And seriously, keeping changes of clothes easily accessible everywhere is key.
What if your child is just actively resisting? Like saying no, refusing to even sit on the potty?
Yeah, this is tough, and it's a really common hurdle. It might be your child trying to assert their independence and control totally normal developmental stage. Or it could genuinely signal they aren't quite ready yet, or they feel some underlying fear about it.
So what do you do?
The sources strongly advise backing off the pressure. Don't turn it into a power struggle. Forcing them to sit or use the potty almost always makes things worse and builds more resistance. Try to let them feel like they have more control over the process.
And if that resistance just keeps going for weeks and weeks?
If the struggling or strong resistance persists, the sources basically give you permission to take a break. It is absolutely okay to pause, go back to diapers for a few weeks or even a month, and then try again later when you both feel more prepared.
But keep talking about it.
Yeah, don't drop it completely. Continue to talk about the potty casually. Maybe keep looking at those potty books or videos together during the break. Just keep it low-key and positive.
Fear of the actual toilet itself came up as a common issue, too.
Understandably so. I mean, think about it from a child's perspective. It's big, it's often loud when it flushes, and things literally disappear down a hole. It can seem pretty scary.
So how do you help with that?
Well, using that small, floor-level potty chair first can significantly help build comfort before moving to the big toilet. Another technique mentioned was letting them maybe empty a soiled diaper into the toilet and then flushing it together so they can see exactly what happens in a controlled, non-threatening way.
Okay. And what about refusing to poop on the potty, even after they've kind of mastered peeing? That's another one I saw mentioned frequently.
Oh yeah, the classic pee-trained but poop-resistant kid. It's very, very common. Often this is driven by fear too, maybe fear of the mess, fear of the sensation, or actual discomfort if they've ever been constipated.
So what helps here?
Again, heaps and heaps of praise when they do manage to poop on the potty is vital. Make it a huge celebration. One temporary strategy, if the anxiety seems really high, is actually allowing them to wear a diaper or pull up only for poop time, but having them do it in the bathroom, maybe even sitting on the potty while wearing it, then gradually transitioning.
And talking about it.
Yeah, continuing to normalize body functions, maybe using books like Everyone Poops can really help reduce that anxiety over time.
Constipation seems like it can really throw a wrench in the works.
It absolutely can, and the sources really highlight this as a significant potential roadblock during potty training. If it hurts to poof, they become fearful of trying to go on the toilet,
Right.
which leads them to withhold their stool, which then, of course, worsens the constipation. It becomes this really difficult, painful cycle.
So what did the sources recommend to actually address constipation if it comes up?
Dietary changes are the first line of defense. Increasing fiber intake is crucial. The sources mention aiming for around 19 grams per day for 1 to 3-year-olds and about 25 grams per day for 4 to 8-year-olds.
Where do they get that fiber?
Good sources include whole grains, lots of fruits, especially things like prunes, apricots, plums, raisins, and vegetables like broccoli. The sources suggest trying to distribute that fiber throughout the day, not just all at once. They also recommended limiting foods low in fiber like white rice, bananas, some low-fiber cereals, and potentially reducing dairy intake, as that can sometimes contribute to constipation for some kids.
Fluids, too.
Absolutely. Ensuring adequate fluid intake, especially water and maybe some prune juice, is really key. And physical activity helps get things moving too. If these dietary changes aren't enough on their own, the sources strongly advise consulting your doctor about potentially using appropriate laxatives or stool softeners. Don't just guess on those.
Okay. And what if they're resisting using the toilet, specifically at daycare or school, but they're okay at home?
That's another specific challenge that came up. The advice is to talk openly with their caregivers or teachers. Understand the bathroom routine and environment there. Maybe it's noisy, maybe they lack privacy. It's really important not to make your child feel ashamed about it. Sometimes the same incentives that work at home can be applied collaboratively in that setting with the caregiver's help.
Okay, now shifting gears a bit to nighttime training. The sources are very clear that this is kind of a different ball game from daytime dryness.
Completely different, yeah. It generally happens much later, as we mentioned earlier, because it's tied much more closely to those biological development factors.
There's mature processes.
Exactly. It relies heavily on things like consistent production of that ADH hormone we talked about, and the brain's ability to reliably wake the child up when their bladder is full, where they're asleep. You can't really train those reflexes in the same way you practice daytime potty skills.
But here's a really intriguing insight I found in some of the research reviewed. Some sources actually suggest that initiating nighttime training earlier might, for some kids, lead to achieving consistent nighttime dryness sooner.
That point was fascinating, wasn't it? And it ties into another kind of surprising observation from the research, that modern disposable diapers and pull-ups, because they're so absorbent, might inadvertently prolong the nighttime wetting process for some children.
How would that work? That seems counterintuitive.
Well, the thinking is because they're so incredibly effective at wicking away moisture immediately, the child might not actually feel the sensation of being wet when they have an accident overnight.
So they don't get the feedback.
Exactly. This can hinder them from developing that crucial brain-bladder connection, that feedback loop needed to learn to wake up when their bladder signals it's full. The sources suggest that for children who are already quite consistent with daytime potty use but still struggling at night, removing the superabsorbent diaper or pull-up might potentially help increase their awareness of wetness if they're showing some other signs of readiness overnight. It's not for every kid.
Okay, so what are those signs of readiness for nighttime training, besides just being reliably dry during the day?
The sources point to several things to look for. Has your child been consistently dry during the day with very few accidents for at least, say, 6 months? That's a good baseline.
Okay.
Are they sometimes waking up dry after naps, or even occasionally waking up with a dry diaper after a full night's sleep? Do they seem to wait until the early morning hours to wet their diaper rather than soaking it earlier in the night?
Oh.
Do they ever express a desire to wear underwear to bed like a big kid? Or do they sometimes take their wet diaper off themselves first thing in the morning? These can all be clues.
Is there any way to test it?
Yeah, one simple assessment suggested in the sources is to just check their diaper maybe 20 minutes before their usual wake-up time. Do this for about a week. If it's mostly dry during that check, they might actually be ready to switch to underwear with potentially minimal extra training needed. If they're still saturating diapers consistently overnight, then a more hands-on approach might be needed, or simply waiting longer for more development might be the best bet.
Okay, let's talk practical tips for nighttime then. What did the sources recommend once you decide to actually try it?
They offered several strategies. Some sources suggested, maybe for the first few nights, letting the child sleep bottomless. Just a shirt, maybe socks with a waterproof pad underneath them, of course. The idea is to really maximize their awareness of any wetness.
Okay, maybe a bit messy, but makes sense.
Yeah. Setting up a convenient nighttime potty station is also key. This could be a small potty chair right there in their room, which is especially useful if they're still in a crib. Or, if they're in a bed, just ensuring really easy, maybe nightlight lit, access to the nearest bathroom. Keeping it close helps make those middle-of-the-night trips quicker and less disruptive, so they can get back to sleep faster.
What about managing fluids before bed? That seems like a classic one.
It is. Limiting fluids in the couple of hours right before bedtime is a common recommendation, maybe no more than about 4 ounces between dinner and sleep. However, the sources also emphasize not restricting fluids too much throughout the day. Overall hydration is really important for bladder health.
Okay.
Another interesting tip mentioned was the double void. That's having the child pee twice within about 30 minutes of actually getting into bed, just to try to ensure their bladder is as empty as possible before they fall asleep.
And practice runs seem useful for everything in potty training, even night.
Yes, apparently. Doing practice runs while they're awake, physically walking them through getting out of bed, going to the potty, wiping, flushing, washing hands, getting back into bed can help them mentally prepare and know the routine. And if they still need help getting out of a crib or just navigating to the bathroom in the dark, using a baby monitor so they can easily call you is important.
Clean up for nighttime accidents. Sounds like it could be pretty overwhelming, especially night after night.
It definitely can be. A really practical tip that came up from parents in the sources is layering the bedding. So you put down a waterproof mattress protector first, then a sheet, then another waterproof pad or even a thick towel, then another fitted sheet on top.
Odd genius.
Right. If an accident happens in the middle of the night, you can just quickly strip off the top wet sheet and waterproof pad, and voila, there's dry bedding right underneath. Minimal disruption.
That's a great tip. And if an accident does happen and they wake up from it, what do you do then?
Even if they've already wet the bed, the sources still recommend having them sit on the potty afterward. This can help them maybe pass any remaining urine that's in their bladder, and it continues to reinforce that connection between the urge to go or the feeling of being wet and using the potty even right after the accident happened.
Okay.
Also, you might find you need to temporarily adjust their wake-up time slightly, maybe getting them up just a bit earlier than usual, or going in right as they start to stir in the morning to get them to the potty first thing and prevent those early morning accidents right before they wake up.
And just like daytime, regression can happen at night too. It's not always linear progress.
Absolutely. It's really common to have some good dry stretches, maybe even weeks, followed by a period where accidents start happening again. The sources reassure parents that this is usually not a reason for major concern, especially in younger kids, unless it's persistent or accompanied by other new symptoms.
Okay, so while many of the challenges we've talked about, the accidents, the resistance, the fears, are pretty normal parts of the whole potty training journey, the sources are also clear that there are specific times when it's definitely best to consult your child's healthcare provider.
Absolutely. You don't want to miss something that might need medical attention.
So, when should parents definitely reach out to the doctor about potty training struggles?
Okay. The guidelines suggest you should consult them if your child is older than, say, 2.5 and shows absolutely zero interest in even starting toilet training, or if they're older than 3 and are just consistently not getting the hang of daytime training despite consistent effort.
What about specific behaviors that might signal a deeper issue?
Yeah. Also, reach out if your child consistently and strongly refuses to even sit on the potty or toilet. Or if you have real concerns that they are actively holding back stool, that could indicate significant constipation or potentially other issues that need looking into.
And specifically for nighttime training concerns.
For nighttime dryness issues, the advice is generally to consult the doctor if your child is beyond age 5 and has been reliably daytime trained for at least a year, and you haven't seen any real improvement with staying dry overnight, despite trying various strategies for a while. But it's worth noting, the sources point out that medical evaluation specifically for bedwetting often isn't typically considered until a child is around age 8 to 10, unless there are other complicating factors or symptoms present.
Okay. Are there any specific symptoms that, if they accompany bedwetting, should trigger an immediate call to the doctor, regardless of age?
Yes, definitely. You should contact their doctor right away if your child was previously reliably nighttime trained for 6 months or longer and then suddenly starts having regular accidents again. That's called secondary enuresis. Also, be sure to reach out promptly if the bedwetting is accompanied by any other symptoms, like pain or burning during urination, a sudden significant increase in thirst, noticeable changes in personality or energy levels, increased frequency or urgency to pee, even during the day, if they start having consistent daytime and nighttime wetting, if they seem continuously damp in their underwear, or if they develop poor bowel control, like having stool accidents.
It sounds like the doctor's role there is really to rule out any underlying medical reasons for the difficulty.
Precisely. Those kinds of symptoms could potentially indicate underlying medical conditions that need to be evaluated and addressed. Things like a urinary tract infection, significant chronic constipation, sleep apnea, maybe ADHD, which can impact awareness, or even conditions like diabetes. The doctor can help diagnose or rule these possibilities out and then provide advice tailored specifically to your child's situation.
So wrapping this all up, this deep dive really lays out potty training as this, well, multifaceted journey. It's such a blend of recognizing that a developmental readiness, implementing consistent strategies day to day, and maybe most importantly, approaching the whole thing with a massive dose of patience and positive reinforcement.
It's definitely not a straight, easy line for most kids, is it? We saw just how common challenges like accidents, resistance, and those tricky poop issues are. And importantly, the sources remind us that these aren't failures not on the child's part or the parent's part. They're just part of the learning curve.
Right. And there's so many tools and techniques the sources recommend to help navigate those bumps, from those practical routines and helpful books we talked about to all the positive reinforcement strategies and creative rewards.
Every child really is different, and their timeline will be unique, and that's absolutely okay. I think the key takeaways from all this material are really to try and trust the process, celebrate all those small steps forward, even just sitting on the potty is a win sometimes. And just remember that staying calm through the inevitable mess and frustration is so vital for both your child's confidence and, frankly, your own sanity.
Yeah, definitely. And considering the really fascinating insight from the research suggesting that maybe our super convenient disposable diapers might actually hinder the process for some kids, especially at night, by reducing that critical wetness awareness.
And that initiating nighttime training earlier can potentially lead to achieving dryness sooner for some.
It leads to a final thought to maybe mull over as you navigate this stage or reflect on it. In a world where we understandably prioritize convenience, particularly overnight, with these incredibly absorbent diapers, are we sometimes, perhaps unintentionally, interfering with a child's natural biological cues? Are we maybe slowing down the learning process their body and brain need to go through to achieve developmental milestones like nighttime continence?
And if there's something to that, what does finding that right balance look like in practice? Balancing modern convenience, which is great, with actively supporting a child's innate natural learning process. Something to think about.